The Years of Physical Therapy by Crystal Villarreal. Physical therapy is known as medicine. Medicine goes back all the way to ancient medicine, which starts with the Greek philosopher of Hippocrates. He is the founding father of medicine. He was the person that recommended therapeutic exercises because he understood the principles of muscles strengthening and the ligaments. We move on to Aristotle, who also used rubbing massage using oil and water as a remedy for tiredness. And Galen described the kinetic principles of kinetic movement in the body. And it was through these people that we are able to make big contributions in modern medicine today. As World War I broke out, many of the men were no longer here in the United States and were off in Europe. From there, caused the women not take over just their families, but take over the medical field. And since they took over the medical field, they did help along bedside manner. While they were doing treatment methods back then, it did require them to do bed rest, isolation, splinting and casting of a person's leg. But through this caused a lot of muscle weakness in the legs in this treatment. So in order to help that, they did create rehabilitation services. And they recruited women that were between the ages of 25 to 40, unmarried and assisted. These were known as Reconstruction Aids. The Reconstruction Aids were also divided into two groups, with one group assisting in exercise programs, massage, and hydrotherapy. These are known now as physical therapists. Another group was provided in training in vocational skills to help wounded soldiers get back to work. This was known as the occupational therapist now. The first Reconstruction Aids that made a big contribution were known as Margaret Sanderson and Mary McMillan. Margaret Sanderson was a physiotherapist graduate of Boston Normal School of Gymnastics. She was also the first supervisor of Reconstruction Aids. Her role was to recruit and arrange the training for Reconstruction Aids. While Mary McMillan also made big contributions in receiving a college education for physical therapy. Her role was to train the Reconstruction Aids. Became a director at the Children's Hospital in Portland, Maine, where she also specialized in scoliosis and joint abnormalities. By January 15, 1921 in Manhattan, New York, McMillan, along with other Reconstruction Aids, formed the first association called American Women's Physical Therapeutics Association, AWPTA. And from this, the first publication of association was called the PT Review in 1921. The PT Review included the Constitution, bylaws, and what the standard therapeutics should mean for them. McMillan published her book, Massage and Therapeutic Exercise, in 1921 as the first textbook. Because physiotherapists were becoming such a demand, it also created better education. And the first graduation class of physiotherapy was 14 students in 1934. The next slide is poliomyelitis and the Great Depression, which were the biggest calamities in the U.S. With polio, this did cause a lot of paralysis in patients that caused them to be disabled at times. And one of them was the President of the United States, Franklin D. Roosevelt, and had been treated for polio. But through this also came a benefactor of opportunities for people with disabilities and to help find a faster solution for this. Through March of Dimes Foundation was founded and to take care of the polio aftercare. Unfortunate part, since the Great Depression hit, it also caused a reduction in employment in physiotherapists. But since World War II broke out, this caused much employment for physiotherapy once again for soldiers going out and bringing back women to come here to help aid the soldiers. As soldiers were coming back, new tasks were given to address wound care, amputations, fractures, cold injuries, nerve and spinal cord injuries. So these are new methods that they were taking in and expanding their knowledge on. However, due to other concerns of specialties, physiotherapy was also changed to physical therapy, which is still used today. It also changed since there were no longer women, men were being involved now. So now AWPTA was changed to its name as known now as American Physical Therapy Association, APTA, and that was in 1946. And thankfully by 1955, polio vaccine was created and fundamentally eradicated. By 1960s, physical therapy was thriving and the demand was high, so the training for physical therapy assistants was adopted. In 1997, President Clinton signed a Balanced Budget Act in order to eliminate the medical care deficit and take effect in 1999. Now, the Balanced Budget Act gave an annual cap of $1,500 for both the speech therapy and the physical therapy department to reduce the services given to medical care patients. By the year 2000, President Clinton signed to suspend the act due to the pressure of the patients and general care of everybody. Found out that it was no longer a good idea. Going to more recent years, the year 2006, PTs have now depended on the application of scientific method of clinical practice and finding new evidence for disease prevention and health promotions in the body. PTA has also had a better understanding of delegating the responsibilities from the PT and applying it to the patients. This was very important because in 2013, APTA had a vision statement to uphold transforming society by optimizing movement to improve the human experience. This is very high because from there a bill was sent to the Senate by 2005 to give direct access for physical therapy services as well. And thankfully by 2014, all 50 states passed the legislation that allowed PTs to evaluate and treat patients without physician's referral. That is what direct access meant, and able to give anybody the luxury to go to a therapist and receive any care that they needed without the need of going through a doctor. We are coming to the end of our slides, which is APTA Mission, which is building a community that advances the profession of physical therapy to improve the health of society. Overall, physical therapy is a profession that only wants to involve the community and only want to make the community healthier and always give the educational purposes to anybody that come their way. So this will always be the mission to create better people in the world. Thank you.